Hello and welcome to our live stream event as we discuss depression, burnout, and the heart. My name is Ed Bottomley with the Michigan Medicine Department of Communication, and our panel today includes three experts who will help answer questions about the connection between these mental health conditions and cardiovascular disease. And I'll quickly turn things over to our three experts for some quick introductions. Can we start perhaps with Dr. Riba?
Hi, and thank you so much. I appreciate the opportunity to speak with you today. I'm Michelle Riba. I'm a clinical professor in the Department of Psychiatry here at Michigan Medicine, and also co-director of Workplace Mental Health Solutions, a program that's housed within the University of Michigan Eisenberg Family Depression Center.
Thank you, Dr. Riba. And if we could pass over to Dr. Richmond-Rakerd.
Yes, hi. So nice to be with you all. I'm Leah Richmond-Rakerd. I'm an assistant professor of psychology with a focus in clinical science here at the University of Michigan. I study how mental health problems develop over people's lives, how we can help to reduce people's risk for mental health difficulties, and also how individuals' mental health shapes their physical health and vice versa.
Thank you so much. And finally, Dr. Bhave.
Hello, it's a pleasure to be here today. My name is Nicole Bhave. I'm a general cardiologist here at U of M, and I see patients with a wide variety of cardiovascular conditions, both in the hospital and in the outpatient setting.
Well, thank you all three for joining us today. And before we start, just a few housekeeping items for those watching our live stream. You could submit questions at any time for our panel to answer during the Q&A portion of today's chat. Questions can be submitted by commenting on this video, but please note that your name or your profile name will be visible to others participating. If you prefer a more anonymous option, you can send us a private message via the relevant social channel that you're viewing this on. If you can't stay for the whole chat, or you want to share the recording with a friend, a video of this chat in its entirety will be available on our flagship Michigan Medicine YouTube channel. So without further ado, let's jump into our question section. And the first question reads, what is depression and when should I be concerned? Dr. Riba, can I pass to you first?
Sure. So all of us have some episodes of feeling sad. Sometimes we have an event or something happens in our lives where we get distressed. And it's usually time limited. But what we're talking about today is a continuum of depression, sadness that persists for at least 2 weeks or more. And in that sadness and depression, we would call it a clinical depression, and it might impact on us physically, where we don't sleep well, or we're eating too much or too little. We don't have the energy to go on. We don't concentrate. It affects our cognition, our memory. It could affect our thoughts, where we even feel suicidal at times. And it could affect us in other mood elements, such as anxiety or making us feel irritable. And so if that goes on a period of time, we want you or your loved ones or your friends to tell you about that and to seek medical attention, because it's not only going to affect you in terms of your depression, but it's going to affect your heart health. And that's what we're talking about today.
Thank you so much for that, Dr. Riba. The next question that we have up reads, what is burnout?
Okay, so classically, that term was coined to talk about chronic workplace stressors, where we feel ineffective at work, where we're exhausted or detached from the things that are important, and we don't get enjoyment from or feel that it's worthwhile in terms of what we're doing at work. But that term burnout has been used in other ways. So, for example, caring for a loved one over a long period of time can cause us to feel burned out. So we've modified the definition to extrapolate to other things going on in our life. And so we're also talking about burnout and stress in the context of heart health today.
Thank you. Dr. Richmond-Rakerd, Dr. Bhave, I don't know if you have anything to answer to add to these answers. We can move on to our next question, which kind of looks back on the first two for you, Dr. Riba, and it asks, what might be some signals that I have one of these? Depression, burnout.
Well, if you're starting to say things like, I can't go on, this is too much for me, and it's impacting on your ability to care for yourself and for your heart in this case, such as you're not exercising, you're not sleeping well, you're not eating a good diet the way you used to. And if that mood is, you're crying, you're feeling helpless, worthless, and thinking it's related to burnout or a mood, then it's time to seek medical attention.
Yes, thank you for that. The next question that we have up, I'm going to ask you to answer this first, Dr. Richmond-Rakerd. Is there a connection between my mental health and my heart health?
Yes, so there is evidence for a connection between individuals' mental health and their heart health. A number of studies using different kinds of research approaches have shown that individuals who struggle with mental health problems, including depression, are at elevated risk for physical health problems, including cardiovascular problems. Data that my team and I have, or analyses that my team and I have conducted in large population level data, have shown that depression and other mental health conditions that are diagnosed in young adulthood are associated with increased risk of physical health problems, including cardiovascular issues, such as heart attack, stroke, and coronary heart disease up to 30 years later. So this really suggests that supporting individuals' mental health across all stages of their lives is important. Individuals can experience mental health problems like depression at any stage, including when they're younger and when they're older. But we also know that mental health problems tend to emerge and peak in early life, in adolescence and young adulthood. So the long-term associations that we see between mental health in early life and physical health, including heart health later in life, suggest that supporting people's mental health when they're young, including through timely treatment, could also benefit potentially cardiovascular health when they're older.
Thank you for that. Dr. Bhave, do you have anything to add?
Yeah, so there are very clear connections, as Dr. Richmond-Rakerd said, between chronic stress and a number of cardiovascular conditions, including heart attack and arrhythmia. One of the most extreme examples is a condition called stress cardiomyopathy. And classically, what happens is a patient will have a very sudden shocking event, like a death in the family or something like that, and all of a sudden have chest pain and need to seek emergency attention. And most often that happens in older women. In that situation, people should not assume that they're having a panic attack. If they're having sudden chest pain in the setting of a shocking event, they really need to go into the emergency room and be evaluated. The other thing that I would say is among patients who have chronic cardiovascular disease, mental conditions like depression and anxiety can often conversely affect their symptoms. So they might be more likely to experience chest pain or angina. They might have more problems with their heart racing and pounding and that sort of thing. So there's a very powerful mind-body connection across all aspects of care.
And I might just add to these excellent comments that depression has been shown to be an independent risk factor in many cardiovascular conditions. So it's not just indirect that you're not exercising or sleeping or taking care of yourself. There are some direct physiological effects related to mental health conditions such as depression on the heart.
Thank you all three for the answers there. Dr. Bhave, let's circle back to you and ask, what is the role of stress on heart health, and what types of heart conditions are related to stress?
So as I was mentioning, stress can definitely, it increases the levels of stress-related hormones like cortisol in the blood. And those stress-related hormones contribute to risk for heart attack, as well as abnormal heart rhythms. And then I would say also sort of indirectly, particularly when people are not taking their medications properly, they're not exercising, they're not eating properly as a result of stress, then that can lead to deterioration of previously stable heart conditions. So that's something that I'm always concerned about. If I see a patient in my office who'd been doing well, but they've had a major change and a major stressor in their life, such as a move or a death in the family or something like that, and I can tell that that person's not really taking appropriate measures to follow their usual regimen, then it's important for me to invest the time with that person to make sure that they get back on track.
Thank you for that answer there, Dr. Bhave. And my next question, can it go the other way where mental health issues oh wait, hold on. It looks like the question that I'm asking is has been changed for a second. It reads, how does it work the other way where mental health issues develop after a cardiac issue?
So it's very common, and Dr. Riba alluded to this, after an event, and oftentimes in cardiology, what we are talking about is events. It's a new diagnosis of heart failure. It's a first-time heart attack. It takes people time to really process what has happened to them. And there's a whole spectrum of emotional responses that we see with that. So in that phase of like the first few weeks and couple of months after particularly a new diagnosis of heart disease, it's really incumbent on us as providers to make sure that we're screening people for anxiety and depression. And in our cardiac rehab program, for instance, that's pretty much standard of care, to be asking those questions. And are you feeling, and not just saying, oh, are you depressed? It's, you have to ask the question a few different ways. Are you feeling blue? Are you feeling sad? Are you feeling like, it's not worth going on? So sometimes it takes a little bit more time and effort to draw these things out of our patients. And then if we find that people are struggling, we need to make sure that that they have the appropriate help. Sometimes that's medication, sometimes it's therapy, oftentimes a combination of both.
Dr. Riba, anything to add?
Yeah, so just to emphasize what Dr. Bhave has said. So if you take myocardial infarction as an example of a condition, we know now that the year after somebody's had an MI, if they have depression as an independent risk factor, depression itself needs to be treated because they could have a decreased mortality in the year following a myocardial infarction if one is depressed in a lot of groups of people, if you look at large groups of people. The other way to think about it is if you're depressed before you have a myocardial infarction, often being depressed is a risk factor for having a myocardial infarction. So it goes both ways. It's sort of bidirectional, probably different mechanisms that are at play, although they can be, the same. But so it's very important to make sure one is looking at depression, stress, and heart disease as a total, in totality, not each one individually.
Thank you for that, Dr. Riba. The next question I'm going to push towards you, Dr. Richmond-Rakerd. What are the treatment options for someone with depression or burnout? Are there non-medication options?
Yes. So for depression, there are several behavioral treatments or therapies that have been found in large-scale studies to be effective in reducing depression symptoms. Two main treatments include cognitive behavioral therapy, or CBT, and behavioral activation. CBT is a treatment that focuses on helping individuals learn how to identify and change thought patterns that are problematic, including those that are common in depression, and that have a negative effect on individuals' behaviors and emotions. Behavioral activation stems from evidence that there's a close relationship between our activity and our mood. Spending time with friends, doing meaningful things that we enjoy, trying out new activities and challenges, all of these kinds of things can help to support good mood levels. But many individuals with depression tend to do fewer things and struggle to engage in activities that can improve their emotions, thoughts, and feelings. So behavioral activation really focuses on helping individuals with depression increase their level of activity, even if they don't feel like it to begin with. It involves monitoring daily activities and their relation to mood, identifying values and goals, scheduling and carrying out meaningful activities, problem-solving barriers to activation. Behavioral activation, I think, is particularly relevant when we consider heart health, because some of the activities that individuals find helpful for their mood can also be helpful for their physical health, such as exercise. And there's really a growing body of evidence that supports the effectiveness of physical activity for improving mood and reducing symptoms of depression.
I'd absolutely agree with that. And to get back to cardiac rehab for just a moment. So cardiac rehab is a structured exercise program that we typically recommend for all patients after heart attack or any heart procedure, and often in patients with congestive heart failure as well. And after a heart attack, for instance, it's usually 36 sessions 3 times a week, so a 3-month period. And I think, unfortunately, during the pandemic, our rehab facility was closed for a short period of time. But I think one of the greatest benefits of participating in rehab is the social aspect of coming out, meeting people who also have heart disease, being able to talk, and then also just the reassurance of being able to exercise in that very safe environment as a means of sort of setting habits that hopefully people will continue lifelong.
Thank you both for that. Next question reads, are these lifelong conditions or can I overcome them? I'll pass to Dr. Richmond-Rakerd first, if you could. I don't know if you can answer that one.
Yeah, with respect to depression, what depression looks like for individuals can really vary. Some individuals may have a briefer bout of depression. We might think of this as something like an ankle sprain that they experience. So maybe they go through a very stressful event and struggle with an episode of depression. And then over time, things improve and they don't experience that episode of depression again. For other individuals, it might be something that comes in and out. So they may have an episode of depression, things improve, and then again later in time it comes back. So we think if for some individuals they may experience a single episode of depression. For other individuals, it may be more recurrent or something that comes back over time. What we found, however, is that, for individuals who experience a range of different kinds of depression, that psychotherapy and other types of treatments can be very effective in treating all these different kinds of depression. So if you're an individual who struggles with something that is more recurrent, treatments can be effective in reducing the severity of those episodes and reducing the symptoms of depression, and also reducing the likelihood that depression will come back. And for individuals who may be struggling with a single episode of depression, it may be something that's more longstanding, and they may need some support to manage their symptoms at that time and to reduce the likelihood that it will recur. So for some individuals, their depression is of lower levels of severity. For some, it's higher. For some individuals, it may be a single episode or just a few. For some, it may be more recurrent. But we find that treatment can be helpful in reducing the severity of depression symptoms, also the likelihood that it recurs over time, and help people feel more equipped to kind of manage those symptoms or the warning signs kind of when they can arise.
Sometimes we use the word depression as if it's one thing, and it's really depressions, because depression can be a part of other illnesses like bipolar disorder, for example, or it could be associated with an eating disorder or anxiety. So sometimes these are lifelong, sometimes there's a genetic component. I wish we knew the etiology of what caused some of these disorders, and we're learning more and more. But the good news is they're very treatable with combinations of care, whether it's some form of medication or psychotherapy or self-help. And self-help could be in the form of exercise or improved sleep, diet, apps. I'm sure my colleagues get asked a lot about what apps might be useful, but there are good apps for relaxation, and so it's important to sort of talk about the importance of long-term care. It's hard to be a patient, but getting into a supportive relationship and somebody who knows your history is very important. And with telehealth, it's a lot easier now to see someone like we're doing now. So it's not so disruptive.
Thank you so much for these answers. The next question that we have, I'm going to push actually back to you, Dr. Riba. Can there be side effects from my mental health medications that affect the heart?
The answer is yes. I think all medications have side effects. And if you read the bottle, you wouldn't take anything probably, or if you listen to some of the television commercials. I don't know if aspirin would ever reach the market if it was, coming to the marketplace now. It has so many side effects. The important thing is not to change any of your medications now or stop anything abruptly, but to talk to your clinicians about any side effects that you may have. A lot of times we ascribe side effects to something that we just took or ate. If you get a stomach ache, you say it's probably something that I just ate. But if you have a stomach ache for a couple of days, it may not be something you ate, but it could be something else. So it's important to sort of write it down, because sometimes we have a bad memory of some of these side effects. In terms of some of the really deleterious side effects of some of the antidepressant medication, it could affect your heart in terms of conduction. It could affect platelet aggregation, clotting times, and the level of medications such as statins or anticoagulants. So oftentimes when we're working with heart patients, for example, the pharmacist is very important, who's on the team, looking at the combination of medications. And that's why we ask at every visit at Michigan Medicine, what are the medications you're taking? And are you still taking them? And if you stopped, why? Because we really want to follow this and make sure that you're on the right medications and on the right doses. Sometimes here in psychiatry, we'll even get an electrocardiogram before we start a medication and work with your heart doctor, your primary care doctor, just to make sure that what we're giving to you is not going to interfere. And we have conversations with your other clinicians about the medications where we'd like to prescribe. Stimulants are another good example of a medication that could have good effects, but also negative effects on the heart. And I'm sure Dr. Bhave knows this very well.
Yes, I agree with all the points that you made. And while it's true that many medications for mental health conditions can have effects on the heart, the vast majority of the time, if we work together as a clinical team, cardiologist, psychiatrist, and pharmacist, we can usually find a combination of medications that's safe and effective for both the cardiovascular conditions and the mental health conditions.
Yes, we're always weighing the risks of taking medications for depressions versus not treating the depressions, and what the impact of not treatment will be on the heart and other conditions as well. So as Dr. Bhave was saying, very important to look at all this and whether or not, other ways to help, maybe losing weight or, sleeping more and having an improved sleep. So sleep apnea is a good example of when you're saying that you're sleeping, but you may not be getting a good quality of sleep and you may be interrupted with apneic events. So, that's a good example of why we might look at other ways to be helpful.
Yeah, thank you for those answers. And to circle back and just touch on those points one more time, the other question that I have here, are there risks from stopping my heart medications if I'm dealing with depression and burnout?
So there are definitely a number of potential risks, and the size of the risk and the type of risk really depends on what your condition is and what you're taking the medications for. So one of the periods of time, or 2 periods of time, I would say, when patients are most vulnerable to having very serious negative effects from stopping medications are in the short-term period after a heart attack or a stent placement. Because if they stop taking their blood thinning medicines, the stent can clot off and cause a major heart attack. So that's one of the most extreme examples. Another time would be if we have patients on medicines like water pills or diuretics for congestive heart failure and medications to treat high blood pressure. If those are stopped, then people can get fluid buildup and become very short of breath, and that can be very dangerous. So we always recommend that you talk with your clinician, whether that's your cardiologist, your primary care doctor, or whoever is really managing your care before you make any changes in your medications.
Thank you. Thank you for that, Dr. Bhave. The next question, we have an audience question here. Does OCD have any effect on the heart? And how can OCD patients turn their lives around for the better?
Well, OCD is obsessive compulsive disorder. And a lot of times people with OCD don't come to medical attention. So it's important to, if one has this condition and has been diagnosed, to see someone if it's a disabling condition. We see OCD very early in life, and Leah probably can talk to that. Sometimes people don't realize that a lot of the mental health problems that adults have, if you go back and you discuss with them, there were symptoms much earlier in life, and they didn't get diagnosed, and so people suffer a much longer period of time. There's behavioral management of obsessive compulsive disorder as well as medication management, and so it's important to see a professional who has experience with this, and it's very disabling to have severe OCD, and it gets worse as we get older. So that's why it's important to try to treat it earlier. I should say that it's important as well because a lot of patients with OCD, depending on what their obsessions and compulsions are afraid to come into the hospital. They're afraid that they won't be able to have their routines of hand washing and cleaning, and they'll be thought of as with some stigmatizing ideas. And so it's important for us to have a working relationship with people with OCD before they get into medical trouble, so that we can facilitate hospitalizations, or if they need procedures in this example for their heart, and that they have a team that they feel trusting in. And I think that's a key thing with OCD.
Thank you for that, Dr. Riba. I see the nods from our other two experts. I don't know if they have anything to add to this question.
On a sort of somewhat related note, I mean, aside from OCD itself, just anxiety disorders in general, oftentimes anxiety about health is a very prominent component of that. And I think, unfortunately, there are times when all that worry leads to more doctor's visits, potentially more testing. That sometimes leads to what we call a cascade of, one abnormal test leads to another, leads to another. If the patient really seeks effective treatment for the anxiety, we might be able to head off some of that. So if you think that you have a problem with anxiety, I'd really encourage you to talk to your primary care physician or a therapist or psychiatrist.
Yeah, I would echo that. A lot of individuals with anxiety disorders, but other kinds of mental health conditions also more generally may struggle with embarrassment about having a mental health concern, feelings that they should be able to handle it themselves, fear of stigma, if they seek treatment. These feelings are very understandable, but data show that mental health problems like depression and anxiety are actually much more common than many people realize. And so if you're struggling with anxiety or OCD or other kinds of anxiety disorders, other kinds of mental health problems, it's having an impact on your functioning at work, at home, some more other areas socially. If it's becoming challenging for you to really manage, and it's lasting a fair amount of time, there are treatments available. So it's important to seek treatment if that would be appropriate for you.
And along these lines, what people often do is they self-treat. If they don't come to a clinician, they start medicating themselves really with alcohol or other substances to try to calm themselves down or to feel more like themselves. And so people are going to things like marijuana, which, for some people could really have a very negative effect, especially on younger people with developing brains. And also for people who are susceptible to psychosis, for example, people can get quite psychotic on taking too much marijuana, as an example. But so we see that. And then, of course, young people are taking things that are contaminated with other substances, which really can be very dangerous. So it's important to get the right diagnosis and to try to, work with your providers and come to a good balance of self-help, various psychotherapies, and if necessary, medication, but not necessarily all the time in terms of, a necessity in terms of mental health issues. But sometimes, those are the ways that people do well. And I can't tell you how many times people don't want to take something. And then when I think maybe we should try to get them off, they say they don't want to get off it. They feel so well on it. So, that's usually the norm rather than, the exception.
Thank you all three for the answers there. And I have another question which I'm going to ask all three of you to answer. How do I know when I need to seek expert help?
So I think some indicators would be if the problems are worsening over time, if you're really struggling to manage them on your own, if you're finding that they are really sticking around for a longer period of time. In particular, if you're finding that symptoms are interfering with your ability to work in your job, to engage socially, so with family and friends. So when you're finding that those problems are really kind of interfering in important areas of your life and are something that you're really struggling to manage on your own, those can be some indicators that seeking treatment could be important.
A common question that comes up in my practice in patients is, I'm having chest discomfort and I think maybe it's related to my anxiety. How do I know it's related to anxiety versus a real heart problem? Particularly if it's new chest discomfort then you should at a minimum talk to your physician about it to try to understand, is there anything about it that sounds cardiac in nature? Do you need to have any testing? And, typically chest discomfort that's related to stress and anxiety will improve as the anxious feelings dissipate. So one thing that I often encourage my patients who've had that sort of chest discomfort to do is to try to find ways to decompress in the moment, whether that's doing some deep breathing exercises, going outside, getting a breath of fresh air, doing something that you enjoy. But it can be tricky to understand exactly where the chest pain is coming from. And so it's definitely something you want to talk to your doctor about.
Yeah, it's nobody wants to go to the ER these days. There are long waits, and you hear lots of stories about how long and what happens in the ER. But with people who do have severe conditions, or heart conditions where there's some ischemia, it's often the ER is the very place to have to go. And we used to think about having some chest pain clinics as part of the ER, but it's gotten so, the ERs are so big these days, and with so many patients, that it's hard to have select areas. I don't know if Dr. Bhave can talk more about that, but we do have a psych emergency services area, for mental health conditions, and that's open 24/7 here at the University of Michigan. That's also very busy. But what we really want to do, and we're so thankful for having these kinds of live streams, is try to prevent some of these acute conditions, trying to prevent people from having to go to the ER or acute care services, and trying to have patients and families control more of this so that it doesn't have to get to an extreme phase of it. And of course, during COVID, it was very difficult to do. People missed appointments, not their fault at all. They didn't want to come down with COVID, and before the vaccine, it was particularly difficult. But now that things are more back to usual care, it's important to get regular appointments with primary care, with your cardiologist, with your mental health professional, and to talk about these issues. And rather than talking about burnout, but talk about stress, what's going on in your life, and starting to have conversations with your friends and family about what to do about that, because sometimes we can't eliminate stress, but we can deal with it in different ways. And so that that's where the conversation really should start. Not that you can't handle it, but that you're not strong enough, but what are sort of healthier ways to deal with it.
Yeah, I would echo that. So, most individuals will go through varying periods of stress, some more stressful than others. And so kind of identifying sort of strategies to sort of manage those challenging periods. Also kind of looking for those early warning signs, right? That feelings of burnout or stress might be increasing can also be helpful in sort of alerting people to the need to kind of sort of start to take some of those steps to manage stress, support their mental health in those kind of more challenging periods as well.
Thank you again, all three, for those answers. So going back to that question that I asked a few moments ago, how do I know when I need to seek expert help? A follow-on question to that: it can be hard to get appointments with multiple specialists. How do I ensure my treatment plan coordinates with my mental health needs and my cardiovascular health? That's open to any of you three.
So I would say that, and particularly if you have a mental health condition and then develop a or think you're developing a heart condition, always feel free to reach out to the clinician who knows you best, because we all want to help advance your care properly. And sometimes even though I'm not an expert in psychiatry, Dr. Riba is not a cardiologist, but we have general medical training enough that sometimes we can sort of triage a little bit. So, if a patient tells me that they're feeling hopeless, then I know that they need a really urgent psychiatry evaluation. Similarly, if Dr. Riba hears that a patient's having exertional chest pain, she'll, send that person to me. So we can help triage a bit. And then also just, good communication among the members of your care team longitudinally is really important.
It's good to have, to be in a system of care where the electronic medical record can be viewed by your team. Sometimes it's not possible. Maybe you're coming from another state or moving, or you're working, as Dr. Bhave said, with somebody before you have a heart condition. So, but we all can send notes to one another. We still have the telephone. And if you give us permission, we really like to coordinate. I mean, that's the goal here, to not duplicate tests, not to put patients through things that they don't need to. And so, talking and discussing how we're going to best communicate is always important, especially when you're changing, locations or doctors or clinicians for one reason or another.
Yes, just to follow on from these excellent comments, I think individuals sometimes feel like, if they're seeing a medical provider, that they can only really bring up kind of medical concerns to that individual, or vice versa. If they're seeing a mental health provider, that's the space to talk about mental health concerns, but not necessarily kind of physical health concerns. But I think it's important for people to know that they can communicate these things to both kinds of providers. So if you're going in to see your primary care physician, not just talking about how your physical health has been, but if you find that you're struggling with things like mood or anxiety or stress, to be able to communicate that to them. And similarly, if you're seeing a mental health provider and you are also experiencing care for physical health concerns, particularly those that might have a close relationship to mental health concerns, like things like cardiac issues that we're talking about today, to communicate those kinds of things to them as well. That can be really helpful in coordinating care.
I should say that it's sometimes really difficult, even for us, to figure this out, what's causing what. And I'll just give an example. Many years ago, my father used to fly on a plane to come and visit us here in Michigan, and he stopped the frequency of visits, and I didn't know why. And when we asked, he said that it was very hard for him to put the luggage up on the rack, and it was also hard to walk from the C terminal. In those days, it was Northwest Airlines, to the lobby. And my husband, who's a cardiologist, started asking him more cardiovascular kinds of questions, and it turned out that he really had a severe, he needed, almost acute bypass. So it wasn't easy, and he's in our family, and we were talking regularly. So it's an example of sometimes how hard it is, and he didn't know. He never had any cardiovascular problems. So sometimes that's difficult. In mental health, sometimes the patient is the last to know. The family and friends see changes in weight, in the way their looks, not shaving or wearing makeup, hair is not well groomed. So, sometimes others know more before the patient does. So again, this is not easy. And it's also, it's so important to listen to friends and family and not take it as a negative, but as, that we care about the person and we're just trying to get some help. And sometimes it's hard to negotiate these medical systems. You might call and you're the 20th online to call. So sometimes somebody else could help and take you to the medical appointment and park and get you there, because it's exhausting. And especially if you have heart or depression problems, you might not have the energy to take care of this yourself.
Yes, thank you for those answers. And I see some nods from our other experts Dr. Riba. Let's move on to what looks like our penultimate question. I'll pass this to you, Dr. Bhave. If you have anxiety, panic attack symptoms may look or feel like heart attack symptoms. How do I tell the difference?
No, that's an excellent question, and one that we frequently get. So many of the physical symptoms that occur during a panic attack seem to be heart related. Some of them include chest tightness, pressure, heart pounding or racing. Sometimes there's a tingling or numbness in the hands, and sometimes a feeling of like an out of body experience. And if you've never had a panic attack before, it might not be immediately clear to you that that's what you're experiencing. So if you are not sure, if it's the first time especially, I'd really encourage you to go to the hospital and be evaluated. Heart attack, in addition to, causing chest pain, can also cause nausea and just a general cool and clammy feeling and an unwell feeling. And we can also see those kind of symptoms in panic attack. If, on the other hand, you've had panic attacks before, you know what they feel like, and those symptoms dissipate with your usual treatment for your panic attack, whether that's medication or a relaxation exercise, then you probably don't need to go into the hospital. But if it's a new problem, you definitely need to seek attention.
Thank you for your answer to that. And as we wrap up, one of the questions I always like to ask is, what is the biggest takeaway you would want someone to have from this overall discussion?
I guess I would say don't ignore symptoms that are persistent. You're the only one who knows. And if you're having them, listen to yourself, and what we have to do as clinicians is listen to you. And, we may have to wait a while until it shows itself, whatever it is. But you're not being a nag or a hypochondriac or whatever term you want to put in that sentence. But, let your primary care or heart doctor or mental health professional know about this, and let us talk to you and work with you to problem solve.
Yeah, I would agree with Dr. Riba and just follow on from that to say that, I think we've discussed a range of ways in which there is this really close connection between individuals' mental health and their physical health, in particular, their heart health. And so, sort of doing things to support your mental health, including seeking treatment if needed, could be helpful not only for your mental health, but also for supporting the health of your heart.
I agree with all of those comments wholeheartedly. And the other thing that I would add is that healthy behaviors like getting good exercise, eating a balanced diet, getting plenty of sleep can be very beneficial for both your mental health and your cardiovascular health.
Thank you so much. I think this has been a fantastic discussion, tying in all the answers from our three experts. People online are thanking us for talking about the mind-heart connection. So thank you to all of our listeners and our viewers. Thank you to our experts, Dr. Riba, Dr. Richmond-Rakerd, Dr. Bhave. Anyone looking for helpful resources that, we've mentioned quite a few things during this live stream, you can look in the comments section where we'll be posting things like blogs and helpful resources to look for. And thank you everybody for attending, and have a good afternoon.
Thanks so much.
Thank you.